Thank you. Thank you so much. Oh, wow. Thank you so much for the invitation and the kind introduction. It's so great to be here, everyone. I'm just going to check the levels. Am I too little or too much or just right? Okay, so just, okay, perfect. Then I will not deviate at all from that. It's so great to be here talking with you tonight. This is one of the favorite topics I have to bring to the community. We'll have about 35 minutes. I'll just have a few slides. And then we'll have my favorite part, which is the Q&A, where I answer your questions. So I'll get you warmed up here. Ooh, that changed things a little bit. Sorry, I'm going to just relax into this microphone. So one of the things that's great about coming out here is because, you know, I work in the laboratory and most scientists aren't particularly well trained in communicating anything about what we do. So it's a good chance to connect, and I almost always get these fantastic questions and new things to think about. So this talk is usually something that's as thrilling for me to do because I go back and read and have all sorts of new things to think about. So I'm looking forward to that. Many of us have had those situations where someone like me, whether it's in something that's publication or whatever, has a long list of things that they're going to present to you. And in that list, it's usually something like, you know, 10 things you can do to avoid depression, or 10 things you can do to be a better gardener, or 10 things you can do to be better friends with your dog, or whatever. And there's usually a kind of a sense of like, all right, that's fine, but I already have like 30 other 10 things to do lists. This is just one more list. And I'm hoping that this is not, I will have, by the way, a list for you, but it's hopefully not one of those lists. And I'd like to start this talk by first introducing this cartoon. So it says, "You will live a long and healthy life if you abstain from anything that brings you joy." And I put this up here to remind me of two things. Number one, this list is intended to be something that brings you, not joy, but that is at least is something that is not a to-do list. So I'm in no way would want it to be something where you feel that you must do all these things if that takes the joy out of your life. So this is very much hopefully an empowerment. The other thing is to remind me, and despite the setting, not to be preachy. So that this is intended to be information that I bring from the bench to you, me reading all this literature and then just trying to translate as best I can. I don't have no conflicts of interest to declare. I have no agenda here or anything like that. I'm just, again, stepping out of my usual setting to try to translate for you the best I can what's out there. I will, of course, always indicate where there's some things that we're more certain about and some things we're less certain about, but this is all based on my reading of the science. All right, there it is. That's the list. By the way, I have a handout that you can take with you in case you want to take it away. But so when we talk about brain health, we're really thinking about, you know, our brain's really pretty important to us. So I would say this is an important list. Brain controls our thinking, our feeling, our ability to use language, our ability to move, you know, make sure we have a normal range of emotions, so we want to experience everything in life, et cetera. And when the brain isn't working so well, all of those things become difficult. So really the concept of healthy brain aging is really keeping it functioning as well so that we can really enjoy our lives fully and our lives together fully. With that, you know, there's a sort of a merging sort of, you've probably experienced this or part of this merging shift in terms of the way we think about health. I'm definitely, you'll notice, coming from what is the more holistic, despite being a bench scientist, the idea that we all partner and are collaborative in our health. So this information is intended to empower you to be able to make good choices about your own health rather than being told what to do. So in that spirit, this list is a kind of quick summary of a number of different things that are being investigated empirically in human clinical studies and preclinical studies like I do with rodents, in laboratory settings using more in vitro techniques, precise techniques. But what we've generally figured out in the last few years is that even though I started in the field in the early 90s, really late 80s, I've been studying different kinds of dementias, and you know, for many years, my colleagues were mostly focused on the biological aspects of it. The idea was that we were going to, and I'll talk a little bit more about this in a minute, we were going to find the magic bullet, the miracle cure, the one thing you could take to keep your brain healthy. Those were called nootropics, or to cure Alzheimer's disease and where things are going wrong. And we just had to keep working away at the bench to find that chemical. And I still work in that field, and I'm still a believer that there are medicines that can help brain aging. But you'll see from this list that this is a bunch of things that we call modifiable or potentially modifiable lifestyle factors. So when we say potentially, this is an important disclaimer, is not everyone has that ability to modify, and this is not a list where you essentially have to knock off every single one of them. And if you didn't, and you get Alzheimer's disease, it's on you. No, that's not that at all. This is really options that are available to us, and in a certain level. Now, I'm not going to go into every single one of them, or we'll be here tomorrow morning having breakfast together, and I'd be just down to have a large spatial environment, but I could really give a talk on each one of these. I'm going to instead focus on the exercise component, which you may have heard before. There's a lot of chat about this, but to try to make the case of why this is representative of how we go about thinking about these lists and why it's something to consider. By the way, I always say with these kind of groups, you all, especially when we get to things like cognitive stimulation, education, social stimulation, and support, I always say, you're doing the right thing because you are here now doing exactly that. So pat yourself on the back right now because you're doing one of them just by getting out here. So I'm going to focus on regular exercise. I have a big, though, disclaimer on this. I'm going to use Jean Carper, who many of you may know. She's written a lot over the years about different health things, a big advocate about public communication for health. So it's not a critique of Jean Carper. She wrote a book several years ago, or now maybe 10 years ago, Simpler Things You Can Do to Prevent Alzheimer's Disease. And I have no problem with Jean, but I have a problem with her publisher, which is this little bit of quote that I took out of the back of the book that I think hits on this point I want to make very well. So it reads, did you know that vitamin B12 helps keep your brain from shrinking? Apple juice mimics a common Alzheimer's drug. Surfing the internet strengthens aging brain cells. Ordinary infections and a popular anesthesia may trigger dementia. Meditating spurs growth in new neurons, and exercise is like miracle grow for your brain. Okay. So I especially like that last one and hold that thought, but I'm going to go into that a little bit. There's nothing really wrong with any of those individual sentences. They're all kind of true in some sense, and based on, there's some literature that strongly supports and some less, and some less. But reading them, though, the implication is that, you could kind of choose one and be fine. So apple juice mimics a common Alzheimer's disease drug. Okay, I'll be fine. I'll have apple juice every day, and I'll be set. That is sort of the implication, and that's what I'm going to be sort of going against. If there's one thing in particular that you can do and you'll be fine, rather it's a bunch of potential other things from this list. So what I'm going to do is try to introduce you the big takeaway point that one of the big changes in the field right now is the idea that there's multi-factors. Multifactorialism is rather than the sort of magic bullet miracle cure mindset. And I try to summarize it in a takeaway line, the more the better as much as you can, and I don't have a trademark on that or anything, it just seemed to be something that was kind of memorable. And our goals here, as I've said, is to do as many of these as you can. The more the better, but within limitations, what is the potential to produce ideal functioning and happiness during your life, and to slow the rate of your decline, because let's face it, we're all going to go one day. But what we want to be doing is at least from the brain health point of view, be sharp as much as we can and be able to do the things we want to do, et cetera, until the time comes. With many of these things, this is an emerging field. That's why it's fun to do research in this area, is because we're learning a lot every year. And of course, we're working in the context where, despite, so I've now been in the field long enough where we've been working on drugs to do it, those sort of magic bullet drugs, as we have not produced anything that has been that cure. So we've been not just recognizing the contributions of the other factors, but also recognizing that we haven't really delivered that thing, and to some extent may not. The other thing is you can do these, rather than just waiting around passively for the scientist to finally produce something, you can actually be doing things right now. So, okay, so I'm going to focus on exercise for a couple of reasons. Number one, limits of time, but secondly, because exercise has been viewed and is there's strong consensus on this, is probably one of the most powerful factors, most important things you can do for health in general. So reducing what we call all-cause mortality, a little bit of New Jersey comes out when I do that, which is where I was born. All-cause mortality, exercise is one of the most powerful tools for doing that. Keeps your cardiovascular system very, very healthy, reduces inflammation, a whole bunch of things. And so much so that we've used a phrase called, what's good for the heart is good for the brain. We're so confident in that connection. Now, what do we really mean by exercise? It's really a multifaceted thing. So we talk about multiple components. So the cardiorespiratory part, the endurance ability, strength, balance, and flexibility are all really important parts of that equation, and they all really matter. So much so, we also have to distinguish exercise from another related construct called activity. And activity is really defined by the absence of being sedentary. So in these sort of studies, when we talk about this gradient, we say sedentary is bad. Okay, we're pretty sure about that. You don't want to be doing nothing. So that generally leads to bad things. Being active is good, and adding exercise is better. You'll see there's a lot of questions about how much and other things yet to be answered, but that's the way we sort of think about it. We're so confident this, the Center for Disease Control has developed these really simple guidelines when you know that there's panels of 30 and 40 experts out there and they digest all these studies and they come out with these very simple takeaways and they're pretty confident about. And so what do we mean in terms of a health prescription? So they try to make it sort of palatable and followable and adjustable to what you can do. You know, we're all very different. So one of their basic recommendations is 150 minutes a week of endurance, cardiorespiratory exercise that is moderately challenging. So what we mean is aerobic, and that means getting your heart, defined usually as getting your heart rate above a certain level. And it doesn't have to be precise. I mean, I'm wearing one of those watches, but you kind of know it when you're working pretty hard because you're breathing harder, the heart's going a little bit, and you're usually sweating. So that's kind of what they mean. They also allow you to be active for a certain amount of time and count the same, so that you recommend 300 minutes. So if you figure that out, it's 7 days a week and whatever, about 30 minutes a day, or maybe you like 3 days of an hour or whatever. And then based on its intensity, you can kind of figure out what works for you. They also suggest muscle strengthening activity for a couple days a week at least as a minimum. As being healthy. We also usually recommend some balance and some sort of flexibility exercises as well. Because again, we said, these are all things that are working out the neuromuscular relationship between your brain. And believe it or not, doing this stuff is not just, keeping your ability to do stuff, but it's also actually stimulating your brain. It is doing what it should be doing. Plants don't have brains because they don't need to move, think, or feel. We do because we need to move around and think and make decisions and all that. Okay, so why is exercise so important? So there's a bunch of mechanisms. These are a little technical. I'll just try to give you a smattering. Again, don't want to go into these in any detail, but believe it or not, from the brain point of view, because we have to ask this question, why would I do this? Well, a lot of reasons is the answer. So there's a bunch of positive effects. We don't know which ones are most important, but we know they all happen. So for example, the actual connections between the nerve cells, we call them neurons, are strengthened and increased. The connections are actually called synapses, so the process is called synaptogenesis. So they're making more connections. Connections do the calculations, that is thinking, feeling, motor control, and all those kinds of things. The more connections you have, the better operating your brain is. So exercise actually stimulates that. In some parts of the brain, particularly the hippocampus and around that structure, which is a structure known to be very important for memory, which is something we want, there are actually some new neurons created. The brain generally, once it matures, doesn't create a lot of new cells, but in that particular area and in response to exercise, there are new cells created. The brain demands a tremendous amount of oxygen and glucose to keep functioning, and since it's in charge of everything else, it takes the first cut on all those. But it needs those functioning blood vessels. So why we say what's good for the heart is good for the brain is essentially the same blood vessels that are feeding your heart and et cetera, are also feeding your brain, and the same effects that are bad there are happening up there. And as the brain is not getting the food and the oxygen it needs to function, a lot of bad things start to happen. There's a particular process in the brain called long-term potentiation that we call LTP for short, just to make our lives easier. And that is actually one of the neural basis of learning. So when brain cells restructure themselves and change the way they're firing and the weightings on firings, it's called long-term potentiation. Exercise causes that. Metabolic function, so we look at the functioning of all the neurons and the glial cells and the supporting cells. They are working better metabolically. So not only are they being fed with oxygen and glucose, they're using it more efficiently. The same way muscles respond to exercise as well. It's not that different, and that's why we think about, call it exercising the brain, is really you are doing some of the very same process. And then some of the specific networks that do the kind of cognitive calculations and control language and all those things that are all wired up together to fire together are also strengthened by exercise. And this is quite profound. Additionally, in case that was not convincing enough, there's a whole lot of protective effects. We say reducing the negatives. So again, blood vessels. The exercise is preserving the function of that blood vessel. So not just protecting you from stroke and things, other infarcts, but also really just keeping the integrity of the cells. And one of the reasons that is that the brain is actually, in one way, constructed different than all the other organs in the body, in the sense it has this thing called the blood-brain barrier. It is a specific way that the blood vessels are constructed so that they prevent certain things. They act as a gatekeeper to keep certain things that we don't want getting into the brain out, and certain things in that should stay in. They maintain its own unique environment. And when that blood-brain barrier starts to break down, all sorts of bad things happen. And usually it's because of things like atherosclerosis and hypertension and all those kind of things that are stressing capillaries, they're stressing blood vessels. So again, exercise keeps those blood vessels vibrant and happy. We also you may have heard about problems with chronic neuroinflammation, or chronic inflammation. Well, the brain gets chronically inflamed as well, and we call it neuroinflammation. So again, those processes are destructive over the long term. There causes stress. They get into a feedback cycle. Exercise actually reduces that inflammation in general in the body, but also in the brain. Oxidative stress, when you get free radicals floating around from metabolic processes that are toxic, basically, excessive levels. Exercise reduces oxidative stress. And then there are particular markers that are associated with neurodegenerative diseases like Alzheimer's disease, classically associated with a couple of proteins called A-beta and tau that are toxic proteins in the brain. There's a couple others that are associated with other Lewy body disorders. Lewy body dementia, alpha-synuclein, and TDP-43 are also in the family of things that we don't want created in our brain inadvertently and piling up there because they start to stimulate other negative processes. Exercise, believe it or not, reduces all of those to some extent in some situations. So in essence, this is why I picked this one in particular, because if you think, why should I do this? This going on the treadmill hurts, or whatever, going for a swim or playing a round of golf, all that stuff is happening and is beneficial for 150 minutes or whatever. We know that well, we don't quite know, but we know a lot. So, oh yes, and that's also this other thing. Remember I talked about quality of life. Exercise is also good, we know, maybe you've experienced this, for other sort of well-being things. So enhancing mood, reducing stress, increasing life satisfaction, achieving goals, we call it time competition, as a psychologist, talking the time competition with maladaptive behaviors. It's really hard to, let's say, train for a half marathon and smoke 2 packs a day. So there's those kind of things where they're direct competitions, et cetera. And then also the social support, being able to do things with other people, being in a cycling group, doing whatever you want. But all those things are also added benefits that we know are also beneficial. Now, what do we not know? So right now, there's a lot of questions that still need to be answered in our research. So which types of exercise matter the most? We don't really know. Right now, the CDC and we just basically say, the best exercise for you is the exercise you'll do. It's intended to rhyme that way so you remember it. Okay, so there's very general guidelines. How much and how intense does the exercise need to be? Well, the recommendations are based on a very, very worked out, I'll call it, curve that shows that when you're sedentary, your risk of all-cause mortality, heart attack, and all sorts of problems with your brain, it's bad. So here's neutral. And basically, as soon as you start to exercise and get active, it comes down and you get almost the maximum benefit at that point that the CDC recommends. Then there's increasing benefits, but you have what's called the diminishing returns. And then there's a little debate in the literature that I love where it pops up at the end, but that's usually for extreme endurance athletes right now. We don't know why, and we don't know if it's true because there aren't many studies of those folks. But so you get almost the maximum benefit by doing the recommended amount. And that's really, for most people, should be sort of, that's intended to be an empowering thought. You don't have to be running marathons to get these benefits. Does the patterning matter? We don't know. So we just say, whatever works for you. Is 2 intense days on the weekend and then 5 days of sedentary? Is just sitting too much. And I always tell this story because I'm an endurance athlete. I've been my whole life. And, so my life was going out every day and having that big workout that I look forward to and feeling great about myself and all that. And then I go to work and I sit for 6 hours, basically. And I was like, that's fine, I'm recovering. And then this literature started to emerge that said, no, you should actually get up and move around a little during the day. And I did not want to believe it, and I'm a scientist, so if I don't believe it, it doesn't, well, okay. So then the literature started to convince me that I need to start doing it. So now my colleagues at work see me walking around the hallways in my little labyrinth course or whatever, just every couple minutes, I do some emails and all that. But so that's a big, again, emerging literature. Especially we're finding after you eat. And I'm not going to talk about diet a lot, but those kind of things are really subtle. So if I used to have lunch and then just sit and relax at my desk, and now I'm like, okay, I'm finished my lunch and I'm going to go around and be a little active. Are there interaction among lifestyle factors? How much, when? And this is a really emerging area. If anyone had just read that the Pointer study, which is a study that's really affirms this kind of thing, just released its data and was looking at exercise, diet, and cognitive and social stimulation, primarily cognitive stimulation in folks who were over 60, who were sedentary at the beginning, and at risk for some of the metabolic factors, and they reported very encouraging results on cognitive enhancement in just a 2-year period. So this is more and more stuff is coming out all the time that suggests that these interactions, as I've been saying about the lifestyle factors, really matters. Is outside exercise. I went to a whole conference a year and a half ago on nature and health, and we're starting to appreciate that it may make a difference. I mean, if you like running on a treadmill inside, that's great, but being outdoors actually has benefits by mechanisms we do not know, but they are very clear. And then finally, we have to also kind of factor in, what are the influence of genetics? Again, most of this, what we know about diseases like Alzheimer's disease, are largely not genetic. Almost 97% of the cases are sporadic or spontaneous, as we call them. So, in particular, some are a little more genetic than other in terms of neurodegenerative disease, but by and large, we have to assume that we actually control a fair amount of the variance in these kinds of things. But we still don't understand the individual differences particularly well. We're just sort of getting onto those. And also, again, some of these challenges are, if you're, we obviously don't think about exercise, as there's different cultural patterns, there's different abilities, et cetera. So we also have to take those into account. So just summarizing my thought, my slide presentation, just to get us all warmed up and do some Q&A, I've tried to emphasize that there's multiple factors. I talked a lot about exercise, but I don't in any way want to emphasize that that's the only thing you should be doing. Each one of those could have its own story, and usually when I do a longer version, I talk about diet, I talk about cognitive and social stimulation. Just my focus on exercise doesn't mean that that's the most important thing. Rather, it's about choosing as best it fits to you from the list. So no one size fits all. Just if exercise isn't your bag, then focus on some of the other things that do make sense. Ideally, a little bit of everything, as much as you can, makes a lot of sense. And again, emphasizing that there's probably going to be no single factor, sort of the inverse of this, no magic bullet that we're going to wait on. Now, a lot of the medicines that are potentially helpful, though, and this is part of the multifactorialism, may come through the pipeline and be beneficial that work on a specific thing. And there's also a number of things you can do right now. So again, we know that treating hypertension, both through, let's say, exercise and medication, can be beneficial. So I'm not knocking medications, but just understand them in this context of multifactors and potential, rather than that thing that if I just wait around long enough, it's going to arrive and I won't have to do anything else. Okay, so I'm going to move to the Q&A part, which is my favorite part. So I'm going to try to remember to repeat we're recording here, and I'm the only one who's been given a mic. So I'm going to try to repeat back your questions to you before answering them, which becomes a little memory test for me. So if I get it wrong, just say, that's not what I wanted. So I'm happy to take questions, and I'll try to, thank you. Both, really. So that's a great question. So something like the Pointer study showed that you could actually reverse. I mean, most people did not have mild cognitive impairment or the early stages. They were not in dementia, but that was a sort of mix of the prevention. There's some studies that will show improvement even when you've moved into cognitive impairment. Largely, though, the message, and again, I have talked to younger groups, and they're not as enthusiastic about the message because it's like, oh, I'm fine now. But it would be really good if they were thinking about dietary changes, like things like preventing traumatic brain injury, prevent head injuries and such. I mean, again, they're most common in very young people, mostly young males, and older folks who for completely different reasons. Young males are taking risks, and the older folks are having unfortunate falls and things like that. But either way, they're both bad. So we would ideally try to prevent in both cases. So I'd say prevention, but it's still not too late to have benefits. I think is at least what we should try to think about. Did I answer your question? Okay. Go ahead.
Does anesthesia have any effect on the brain?
Anesthesia? Yeah. Some. Yeah, I mean, so it depends on the type, and I'm not an anesthesiologist, but I do know there's some literature that suggests if you've been deep and under for a long period of time, heart surgery is particularly problematic in that case, and so repeated bouts and close. Now, no, because usually you need the surgery. I mean, I think so. I would say, yeah. See, a lot of these things, like head injury, I don't know how many times I've bumped my head in my life, and there was one particular pipe in my basement that whenever I'd go down to get something with a hat on, and I go, well, that's another one. But, so there's no perfect state here. Obviously, I mean, you might say, well, elective, non-necessary surgeries might not be worth the risk. And these I always say offsets, so in other words, try to do the things that are offsetting would be my thoughts about that. Yeah, I mean, again, almost all of these, and this is why I say it's individual decisions. You're making a trade-off to things. So, do I get the life-saving surgery, or do I have some, and you have to go with the thing. But where you can control, you just kind of note that maybe this is and especially as they pile on, because I'm emphasizing the positive, protective, but you can also reverse that and say, yeah, well, a lot of smoking, a lot of drinking, falling down on my head a lot, and blah, blah is probably going to add up. So, yeah. So to answer your question, if I'd... Yeah, so a differential, and now I remember to yes, I'll repeat the question. Thank you for reminding me. You're going to be my helper on that. So yeah, there's a differential risk. Okay, yes, there's someone had said that you'd heard that 1 out of 5 women would get dementia and only 1 out of 10 men. There is a gender difference in the literature. We don't know if it's a cohort effect that has to do with lifestyle. So in other words, one of the things we would say is, so the folks who are getting, like many of us, a little older, had a lifestyle back in whatever, the 60s or 50s or 70s, that may be different than the lifestyle today, and that may have affected with a number of diseases. So to some extent, for example, dementias are going, track cardiovascular diseases, now, which is usually the reverse with men. So that's one of the interesting things. There's hormone differences is one of the general mechanisms, but we're still, so it is, and there's also a sort of survival. In other words, if you're outliving, age is age is the biggest risk factor for dementia. So if you're living longer, you're at a higher risk. So, and if women from a certain cohort are outliving the men, then they're going to be diagnosed higher. Yeah, so, okay, so let's see. I'm going to get one from the back, and then I'll...
You have a list of natural medicine vitamins
Yeah,
that are most beneficial to stop this dementia.
yeah,
I'm getting away from pharmaceutical,
yeah,
the drug industry,
sure.
so I don't know what benefits they have, but if we can find some natural fixes to help us with our brain that won't hurt our body, I'd be interested in that list.
Yeah, well, there is a lot of interest in, and again, I didn't get to the feeding part, the appetite and the diet part of it. I go into technical talk, but the diet part. But one of the focus areas is what's called micronutrients, which includes various vitamins, various other compounds. In general, that would be a great thing. What I typically say is, and the experts recommend, is try to eat a healthy diet and get all of them together through the natural foods. That is the recommended thing, as opposed to supplements, and especially not any particular thing. So we're talking about vitamins as a solution or other sort of food. Now, again, compared to drugs, that may be, certainly, having a healthy diet is one of the major important factors. There's some specific diets that try to emphasize these. There's, you may have heard, everyone's probably heard of the Mediterranean diet, which is a bit hard to pin down, but we generally know it, and we usually say the Western pattern diet is the bad one, and that's the one you know it when you see it. Just picture a vending machine or a McDonald's that's being recorded. A fast food chain, generically. So the diets that seem to emphasize the nutrients that are particularly relevant for the brain is called the MIND diet, conveniently, which is a sort of conglomerate of the best elements of the Mediterranean diet and the DASH diet, which is the diet designed to control hypertension. And then it adds things like berries and other things that have compounds that we think are beneficial for the brain. But taking, let's say, a particular supplement, there's no evidence outside of some studies that are in what we call preclinical, like in rodents or whatever, where if you give really large doses, there may be effects, but they haven't really translated out in any convincing way. I don't want to say anything about the supplements you can buy in the drugstore, but understand that I always say that despite what they advertise, there's no to extremely almost no clinical evidence that they have any benefit, at least that have been evaluated to the standard of a pharmaceutical by the FDA, et cetera. So people take them, that's okay. If you want to, that's fine. But as I say, they haven't been evaluated. But I'm not against nutritional approaches, but they just tend to emphasize have it through your diet rather than through supplements. Yes. Sorry.
I've heard that you really should exercise your mind every day.
Mm-hmm.
And I try to do that. Is there anything that you would recommend, like should we do a crossword puzzle?
Mm-hmm.
Or go to the New York Times, do connections?
Yeah. So how to exercise the brain? I try to do the summary. So what are the different ways you can do it? So generally the literature shows that the more complex and the more challenging the activity, the better the benefit is. So it's, and what we mean by that is that, so just like with exercise, if you've adapted to it and do it repetitiously, you're probably gaining no additional benefit. So some of the brain training, it's called, literature studies that work usually with a complex set of tests, so memory exercises, spatial kinds of things, et cetera, where they're constantly mixing it up. However, the brain training games approach alone has been shown to be weak, if not ineffective. Essentially, we get better doing the games, but it doesn't generalize to the rest of the things, to our abilities. So what is more often, and just like with the food, essentially you want to get your stimulation from as many possible sources, including the social and by human interactions. We sort of take it for granted, but regular human interactions in new and novel ways, doing things is actually quite stimulating. Going to new places, meeting new people. We always say analogy is like trying, not that you have to learn a new language, but you know what big, tough stimulation is when you try to learn Spanish as a 55-year-old. You know you're working your brain. So now how you do it should be pleasurable. So if you enjoy, my wife goes through her regular routine every morning with Sudoku and blah, 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 blah. But she doesn't stop there. She then goes to Ollie classes and she does these sort of things and she goes out and exercises with a friend and, and all that. And she knows she's very fortunate to be able to do that. But, that constant new stimulation is best. And if it's a little hard, a little challenging, that's the best. So if you do the puzzles and all that, the crossword puzzle, that's great, But if, let's say, you're like, no, guys, I can't come out for coffee today because I've got to finish this crossword puzzle because it's helping my brain, you're probably going to be better off going and finding out what the situation is over at the coffee shop. So, sorry, I don't mean to be flippant. I got one back and then, yes.
Thank you for taking my question.
Sure.
One of your first slides you mentioned, you talked about environmental issues.
Yeah.
And given the fact that microplastics have
Mm-hmm.
permeated our environment and our food supply, I wonder if there's a direct connection or is there any research being done
Yeah.
on microplastics in our food?
Yes, there are. There is a very exciting emerging literature. So environmental toxins are one of those. Oh, sorry. Microplastics. Are there any research being done on the effects of microplastics and other environmental toxins on the brain? Yes, thank you. So yes, that's one of the emerging literatures as we're realizing that microplastics are everywhere. One of our investigators at the Ryan Institute, Jamie Ross, is actually been working in that area, and she's shown that microplastics do get into the brain, the little tiny ones, and cause an inflammatory response. That's of concern. She's continuing her research on that area, and she's been working with other environmental scientists and toxicologists in this area. She's not alone in that, but this is another emerging literature. We've known for years that environmental toxins are, in some cases, directly toxic. Other times, and in other ways, they're also just stressors on the body. And again, the stressed body is not optimal for the brain health either. So yeah, lead has been a concern. Other toxins, again, Dr. Nasser Zawiya in our College of Pharmacy has a long career. We're looking at environmental toxins and the relationship between Alzheimer's disease. So URI has done some of that work, and there's still emerging literature on that as well. So that's a great question. Let's see. Now I have to remember where all the hands were. Okay, so let's see if I studies of excessive cell phone usage. Wow. Every time I get one brand new question, as I say, and this is where I say, I don't think so. Yeah, so I mean, I should take that back. Specifically for dementia risk, we are very concerned about again, the patterning and the general changes. So when I said cohort effects, it could be that in 20 or 30 or 40 years, because, things really changed a lot. I mean, there was a phone attached to a cord when I grew up, and we all shared it. And now, so it's so that is a potentially an interesting, because it has really changed the way we interact with each other. So. The people in Silicon Valley limit their children's access to phones. I will not comment on that, but so I may need funding from one of them. But yeah, so let's see. I guess I'll no. Go ahead.
This kind of goes along with what we're talking about here. Wi-Fi is everywhere.
Yeah.
It's in your car now.
Yeah.
Wi-Fi in your car. And I wondered if there have been any studies on the effect of Wi-Fi on your brain.
Mostly the literature suggests that modest radio frequency signals, et cetera, are not a threat. So, it's not a particular concern. Didn't make it onto my list. Yes. No tinfoil hats, no. So radio frequency sequences and Wi-Fi, et cetera, is not of concern to us. Let's see, I want to make sure I get everyone's guess. Sure. Uh-oh, you only get one. No.
Sports are supposed to be good for your brain because of all the interaction, but it also, when you go on vacation, you remember everything you've done, but you can't remember what you ate yesterday.
Yeah.
You remember everything on your vacation because it's different, and somehow we may need to take a different path someday.
Yes.
To stimulate our brain because it's so automatic.
Yeah. So why do we remember everything from vacation? So partially, right, the novelty of the environment, you're connecting new stimuli. Also, attentional processes are there. You're really, really attending to new stuff. Surprisingly, we're not even aware of it, checked out a lot on the repetitious stuff. Anyone who drives the same route to work every day, someone said, oh, there's a new house there. And I'm like, really? Oh, there's a new house there. Because so indeed. But it also suggests that, again, if you're feeling it, the brain is sort of taking in a lot during those, so that would be a case of going on vacation as being a really stimulating event. I will allow you your second question.
I also heard that older people in Rhode Island can take classes at URI, RIC, and community college. They can audit for if there's availability, so you can check into that.
Yeah.
There is some kind of allowance. I think you get the tuition waiver
Hmm.
for not meeting the registration. There's some kind of thing where you can sign up for classes.
Right, so in classes at URI, that's the OLLI program, and probably some others. Rick? I'm sorry? Oh, college classes enroll.
I know Ollie's down there at the university.
Yeah.
Down there.
Yeah.
But I think that you can actually take classes.
Taking classes. Okay, that's great. I didn't know that, but that's wonderful, and so that's a great source of continuing stimulation, is those kind of. Yeah, and that's always one of those things where you can, so what is the effects of diminished hearing, and I'll throw in vision on that just to be complete. So we're, more and more it's emerging that you're doing a good job keeping that, because I can see you down there, and I'm like, oh, I got to repeat the question. So thank you. Yes, so while you do the best you can, that's one of those things kind of like keeping your gums healthy. You're not going to get them back, but you just want to keep them in there. So the basic takeaway message is, yes, there's an emerging literature that both through direct mechanisms, so less input into the brain from the actual sensory, the eyes and due to the impairments, but also a very important thing is that they can affect your actually social environment. So as you start, you can't hear as well, so your social group gets smaller and smaller. You may not go out as often. Again, visual impairment can make increased risk and whatever, and that has a big effect. So it's a lot. When we say a lot of these factors interact with each other, it's because even though yes, it's a biological effect, it becomes a biopsychosocial effect, as we say. It's affecting something else. We said the causality in this case is never linear. It's very complicated. So in general, you do, the recommendation is do what you can. So, make sure you're visiting an audiologist and getting hearing aids checked and whatever to protect what you can as long as you can. So, let's see. What role does heredity? Well, it depends. So, what role does heredity play? If it's, let's say, we always say the healthy brain aging is, again, not going to be into dementia, but rather just the sort of natural loss. Some people will be sharp really, really far into advanced age, and there's a term for them. You may have heard it, super agers, and one aspect of super aging is just this mental sharpness. Now, of course, when you look at the lifestyle super agers, there's often they've done a lot of good things to preserve it. Some people are just lucky, and that's what we put to the genetics, because we say, oh, they didn't, they did everything wrong, and somehow they're old and they're sharp. But so there is a contribution. So, for example, if you're higher risk factor for cardiovascular things, what's good for the heart is good for the brain, so you would want to be aware of that, and that will have a benefit for the brain. neurodegenerative disease in particular, each disease has specific risk factors they can put probabilities on. Again, Alzheimer's is, in terms of direct risk for what we call autosomal dominant, familial, inherited, the only 2 or 3% contributions, only 2 or 3% people get the early onset that they get in their 50s, let's say, and that's because they've unfortunately have a direct genetic link to a particular mutation that's been passed in their family, and there's families and groups with that. But most of us are primarily some combination of risk-enhancing genes. So ApoE4 is a particular gene that's talked about a lot, but there may be 20 or 30 others that we're still trying to understand that enhance risk, but they're usually enhancing risk through some indirect mechanism that might be offset by some of these lifestyle factors. So they're just, something. And other neurodegenerative diseases have a greater contribution. And again, we don't know why. So hopefully I've over-answered your question, but hold on one second. Any other questions from around that I missed? Oh yeah, I knew. Okay, yes.
There was a full-page article in this week's Economist
Ah.
talking about the benefits of creatine.
Creatine. Okay.
It's good for building muscle.
Yeah.
Talk about having brain effects.
Yeah. Yeah, and again, I would say that, it's definitely one of those things that, in creatine, are there benefits for the brain? And it's a hot topic because it's being used a lot in exercise, weightlifters, and everyone trying to maintain muscle. There is some literature suggesting it might be beneficial. Again, the gold standard for demonstrating something like that is what we call the randomized controlled trial, clinical trial, double-blinded, incredibly expensive, hard to monetize, something that you can sell it. So those kind of studies, when there's evidence, it's usually at a much lower standard. It's epidemiological. It's what case-controlled studies they're called, where you just sort of say, did you do this thing in your life and not. So a lot of the evidence, and then animal studies like I do, which are, kind of, some translate out really, really readily. So I get rats to exercise. They run on little treadmills. People run on treadmills. You get the same biological effects. But drug or nutrient in particular don't necessarily always translate out of the rodent models exactly the way we would want to the brain. So it's interesting. It's a big market right now for other reasons. And with marketing, if you can get a bigger market, it really helps if you've already invested in something. I wouldn't, again, major takeaway, I wouldn't put all your eggs in that one basket. You could try it out. Oh, by the way, I should say, that's prompts me to think of one other thing. What I always suggest in this kind of individualized thing is what I call the N of 1 study. There's never any harm in you trying, it's not going to hurt you unless you took excessive amounts of anything or you're well out of your own. So, it's worth a try, but establish a baseline condition, try to get some measure you can kind of trust. It could be playing an online game or whatever. Try the thing for 2 or 3 months, take the online game, and then stop it for a while. Now, ideally, you wouldn't, you have someone in cahoots with you who says, okay, I'm not telling you whether you're taking the creatine or not, and keep it blinded. But, see if it works for you, So, again, you can try any of these things, but the idea is to be objective, as objective as you can make it. Sorry, let's see, thank you for your patience. Thank you. Yeah. Well, that's really, so will doing the things from the list help somebody with dementia? I would say, I'm carefully picking the words. I'd say there's no reason to not try to. So first, obviously, some of these things, if the person was doing them and they were beneficial and they stopped doing them, and that's part of the concern, that's going to accelerate. Again, there's the specific studies where the reversal happens is very rare, and this is for pharmaceuticals, even the best things we have right now, nothing reverses. So what we're usually looking for as a goal, which unfortunately is kind of modest, is stasis. We're trying to prevent additional loss. Since a lot of these things can also have a social element and also I'm doing something to help for everyone. So there's a whole dimension on the caregiving side of things as well. So it's very, very hard. Dementia is very, very hard on caregivers and family and whatever. And so, hope is an important thing. But at the same time, again, there's a lot that is yet unknown. So I wouldn't say, no, don't do this. So keeping someone active, for example, however is possible where they are would be, I think, highly recommended. It's also quality of life thing. So it's not a terrible thing to go out for a walk and just sitting watching TV, let's say. That's certainly going to go in the wrong direction. I want to make sure okay, yeah, sorry. I get blinded every time I come out here, so that's why. There we go. Anyone I have not taken a question? Okay, go ahead.
I know that with rats and stuff, sometimes they do restricted calories.
Yes.
And they live like twice as long as the other group. They may not have all the nutritional, that provided, but they tend to live longer. And there's also this new stuff called intermittent fasting.
Yes.
Not eating all the time. Still getting all, but giving your stomach a rest.
Yeah.
Having like a 6-hour window where you eat and then you not eat for the remaining of the day. What you're saying on that?
Great question. So restricted calories and intermittent fasting, it's a totally emerging literature here. Right there's one of the important distinctions that's being looked at. Intermittent fasting without calorie restriction versus caloric restriction is one of the hot areas. One of my graduate students wrote a whole giant paper on this. And, so as I say, at this point, probably what we would say in summary is when there's benefits on the other known mechanisms of the dietary change. So if, let's say, again, cholesterol, enhanced HDL, reduced LDL, reduced triglycerides, et cetera, we would say, oh, that's good. There's some concern about how much calorie restriction is a dose thing. So if you're having excess and correcting versus going down to a very low level, especially if there's loss of nutrients. So my colleagues in the nutrition department would say, no, if you're losing the nutrients, that's not good. And again, the rodent studies, I do them are different. They're different beasts because they're highly controlled and we make sure we control what they eat. So they are getting balanced nutrition even if we've reduced the calories, and people aren't so great about that. So I think, okay, I'll do one. Sure. Yeah, I can answer. What about alcohol? Yeah, I always get that question. So okay, here's the bad news. So yeah, we used to say, and this happens because the literature gets updated. You probably know, like, a couple glasses of wine for men and one for women is okay, and may even enhance whatever. So unfortunately, now the literature has gone heavily towards that there is no beneficial dose of alcohol. Going back to my original slide, though, I'm not going to say, you make individual choices, and if it's, let's say, facilitating a social interaction on, with your friends on a Monday night or whatever, not to excess, it might, you never know what offset. But as I say, currently, the literature is converging on the idea that you can't say anymore, I'm drinking this for my brain health, and it's not working. So, well, on that note, I think we'll end up. Thank you so much, everyone, for a great talk and great questions. Thank you. And I usually just hang around for a while, so I'm happy to talk more, or you can out in the parking lot, wherever works. So, thank you, everyone. Okay.